Hi, I'm Mark Ollis, and today I'd like to talk about anti-inflammatory medications. Now, in general, I'm not a medication guy. I think if you can do anything naturally, if there's a good path, fantastic, do it. There's definitely times when you need medications, and I support those, and thank God we've got them. But for other things, I'm not a big fan. Anti-inflammatory medications are in that class that I like them, and I think they have amazing value. I always tell people, or I've coined my own term of there's an inflammation cycle you can get stuck in. And the example I always use is, what happens when you bite your cheek? Swells up. Now what happens? Well, that swollen tissue is enlarged and it keeps going in places where it normally wouldn't be, and you keep biting your cheek, causing more inflammation. So now you're in that cycle. You keep repeating the thing that's causing the inflammation keeps causing you to go into places it shouldn't be, and now you're stuck in a cycle. This can happen anywhere in your body. So it doesn't necessarily mean that you even had a problem, like say in the cheek example. There's nothing wrong with your jaw. It's not that there was something mechanically absent up here. It's just that you made a little mistake, you pinched the tissue, it swelled up, now you're stuck. So shoulders, knees, those joints especially frequently get stuck in these inflammation cycles. So I do tell patients, take the anti-inflammatories, but take them regularly. A lot of times people, they just take the medication kind of when things are bad. So now you're just riding a cycle up and down. So it gets better when you take the anti-inflammatory medication, but then you stop and then it's back down again. Tell people, be diligent. Now, if you've taken this medication for a couple weeks and it hasn't done anything, I'd say probably stop. Why damage your liver or do things that aren't beneficial? So don't do that. But at the same time, don't give up just yet. I once had a knee problem, got to where I could barely walk. Had to go to the orthopedic surgeon. I can tell you, for a physical therapist to go to the orthopedic surgeon, that is an embarrassing event. It's basically giving up and saying, you know what, I can't fix myself, maybe you can fix me. It's very difficult for me to do it, but I did it because I got oh my God, I can't think of the word. I got desperate, that's the word I want. So I got desperate. I'm having trouble walking. So after 2 or 3 months of this problem, I'm not getting any better. So I go thinking there's got to be something wrong in here. And lo and behold, he writes me a prescription. And I'm thinking, you know, this is why I don't go to the doctor, because you're just going to give me more medication. But I thought I got to do something, so I'm going to try it. I'd already tried like 800 ibuprofen 3 times a day. I was religious, didn't do anything. Tried aspirin, didn't do anything. I take naproxen. In 1 week, my problem was gone. I'd had this problem for 3 months. It's gone. I was shocked. That's when I became a true believer and understood, okay, I do get it. There is a purpose here, and there is that inflammation cycle. And once you're stuck in it, sometimes you can't get out. So when you do have a lack of success with one medication, ask your doctor, hey, is there another medication we can try? Because not every medication works for everybody. Ibuprofen didn't work for me at all. Naproxen did. I've talked to tons of patients. Naproxen doesn't do anything. Ibuprofen does fantastic things for them. So try something different. Now, if you've tried a couple, 2, 3 times and nothing's working out, then I'd say, okay, maybe anti-inflammatories aren't going to help you out, and perhaps that's not even the problem. But it is important. Be diligent. Keep taking your medications on a regular basis, keep trying different ones, and oftentimes you're going to find great success with this. And then, you know, egocentrically, I'm a physical therapist, I would suggest make sure you do correct possible mechanical problems that led to the inflammation in the first place. So I hope this helps you out. Thanks.